this stage, your OB probably won't offer this test to everyone, but they might discuss it with women who have certain risk factors. Week 14 of pregnancy is often a very welcomed week. Morning sickness is starting to get better, and that overwhelming urge to sleep 18 hours a day is finally easing up. You might even start to notice a little baby bump, but it's not quite big enough to get in your way just yet. If you're new here, you're watching In the Health and Medical Zone. And if you're new here, In the Health and Medical Zone means in good health and spirit. So, if you like being healthy and happy, click subscribe because you are definitely in the right place. At 14 weeks, you are about 3.5 months along with roughly 26 more weeks to go. As for your baby, she's now about 3.5 to 4 inches long, roughly the length of a rubber duck, and weighs around 2 to 3 ounces. She's developing hair all over her body. Now that means eyebrows, eyelashes, and even hair on her head. She's also growing a very fine, downy layer of hair all over her skin called lanugo. This hair helps keep her warm early in development, but as she starts to build more body fat, the lanugo will gradually disappear. She's also beginning to make facial expressions. She can grimace, smile, and even suck her thumb. All her organs are becoming more functional now. Her thyroid has started producing hormones. Her liver can now make bile, and her spleen has begun producing red blood cells. By 14 weeks, your baby's genitalia are fully formed, so it's possible to tell the gender during an ultrasound if you can get a good look. Sometimes it's a bit early to see clearly though. Your OB might be able to tell you the gender at your next appointment. Since your baby's organs are more developed now, the risk of miscarriage is much lower. For many parents, this is the time they feel comfortable announcing their pregnancy to family and friends. Your next routine appointment will usually be around 16 weeks. Like I mentioned earlier, your OB might be able to tell you the gender then, but sometimes it's still tricky. Maybe your baby's being a little modest and not giving a great view. Sometimes the umbilical cord is between the legs and looks a bit like a penis, or the penis might be hard to see, making it look like a girl. So if your OB doesn't give you a clear answer, just hold off on painting the nursery pink or blue until you can get a better look. By this stage, you'll notice a lot more movement from your baby on ultrasound, even if you can't feel it just yet. Your baby's arms and legs are growing longer and becoming more proportionate to the rest of the body. And she's starting to move around a lot more too. You can see these little wiggles and stretches on ultrasound, but it will still be another month or two before you can actually feel those tiny kicks yourself. At your upcoming appointment, your doctor might offer a few different tests to check for genetic abnormalities. One option they might discuss is called amniocentesis. If this test is done, it's usually performed somewhere between 15 and 18 weeks. During the procedure, your OB inserts a long, thin needle through your tummy into the uterus to collect a small sample of amniotic fluid. This fluid is then tested to determine whether your baby may have a neural tube defect or other genetic disorders. There is a small risk of miscarriage with amniocentesis, anywhere from 0.2% to 0.5%. That means about 1 miscarriage may occur for every 200 tests done. Because of that risk, your OB probably won't offer this test to everyone, but they might discuss it with women who have certain risk factors. For example, if you're over 35, has a family history of genetic disorders, or if any of your earlier blood screenings has come back positive. Now, if you don't want to do an amniocentesis, and honestly, most people don't, but you still want some form of testing, there are simple blood tests available, like the quad screen. The The quad screen checks for conditions such as Down syndrome, spina bifida, and trisomy 18. It's usually done between 15 and 18 weeks, but can be performed up to 22 weeks. Just keep in mind that this is a screening test. Even if your results are negative, it doesn't absolutely guarantee that your baby doesn't have a genetic disorder. And if it's positive, it doesn't necessarily mean that your baby does. If your quad screen does come back positive, your OB might suggest additional testing if that's something you choose to pursue. Another option is prenatal cell-free DNA testing. The important thing is to talk to your OB so that, together, you can decide what kind of testing, if any, is right for you. Even if you decide not to do any genetic testing at all, your ultrasounds can still help identify signs that something might be wrong. Now, remember earlier when I mentioned lanugo, that fine hair that covers your baby's body? Well, there's an old wives' tale that says if your baby is hairy, you're more likely to have heartburn. That's not true, but you are more likely to have heartburn during pregnancy than when you are not. Here's why. When you're pregnant, your body releases certain hormones that help relax the smooth muscles throughout your body. Unfortunately, those same hormones also relax the muscles in your gastrointestinal system. When the smooth muscle in your esophagus relaxes, stomach acid can travel back up into your esophagus. That's what causes that burning sensation right here in your chest, better known as heartburn. Other symptoms might include a sour taste in your mouth, a sore throat, or even a dry, irritating cough. If you're experiencing heartburn, head to the pharmacy and pick up some Tums. They're safe to use during pregnancy, and as a bonus, the calcium is actually good for you. Just make sure not to take more than what's recommended on the bottle. You can also take over-the-counter options like Prevacid or Tagamet. Those are safe during pregnancy too. But if you're really struggling with heartburn, be sure to mention it to your OB. If you want to learn more about dealing with heartburn, I actually covered it in detail back in week 10 of this pregnancy series, so make sure to check that out. And one last reminder, when your baby finally arrives, don't expect to walk out of the hospital in your pre-pregnancy jeans. You're going to have some swelling and extra weight, and that's completely normal. It just takes a little time to fit back into your pre-baby clothes. Thank you so much for watching.